Hey guys, Dr. Siab, cardiologist here. So this is so silly, and I'm sure you've seen this. The internet has been going crazy for the last few days, trying to diagnose Donald Trump with some sort of medical condition based on just photos. I'm sure you've seen photos like these where people have noticed apparent swelling in his legs or the appearance of his hands and are trying to diagnose him with some sort of crazy heart condition that the White House is hiding. The White House released a statement today saying that Trump underwent a comprehensive examination and was diagnosed with something called chronic venous insufficiency. As a cardiologist who treats people with leg swelling, including those with chronic venous insufficiency, let's talk about this. First of all, you guys know I've been doing social media for a long time, and I've said this time and time again. People should try to stop diagnosing other random strangers on the internet based on just photos, especially when they're not that person's doctor or have the relevant medical information. Just stop doing it. As I replied to somebody on Twitter, ankle and hand swelling has like 10,000 causes. Okay, there are so many causes of this, and it can be anything from a benign condition to a more serious heart condition, such as heart failure. And it is impossible to try to diagnose anybody based on just photos. And I said that because he is the president of the United States, it is impossible that he has not had every sort of testing done possible, even stuff that I wouldn't necessarily do for the average Joe on the street, but because he is the president of the United States, of course he has had everything done. And lo and behold, we learned that he has been diagnosed with chronic venous insufficiency. This is related to normal aging-related wear and tear of the veins of your body, commonly in the legs. Sometimes the valves of those veins stop working, and instead of pushing blood up from the legs towards the heart, blood and fluid tends to pool in your legs, causing swelling. Now, obviously, based on the individual patient, we do extensive testing to make sure it is not something that is more concerning, such as heart failure or a blood clot, etc. But in the absence of anything like that, chronic venous insufficiency by itself is a benign condition. It can, of course, be annoying and cause lifestyle issues that we have to manage, but by itself, it is not a dangerous medical condition. It's just normal wear and tear that your body accumulates as you get older. That's all. Now, you guys know I'm not a Trump supporter, right? But it is important to remember that facts are facts, and it is very irresponsible and dangerous for people to try to randomly diagnose people on the internet and spread misinformation. Please stop doing that. And of course, could the White House be hiding some sinister condition that they don't want the country to know about? Of course, I don't know, right? But I like to live in reality, okay? And I welcome you guys to join me.
So earlier today, I reported that Trump was diagnosed with a cardiac condition called chronic venous insufficiency. It causes blood in your ankles not to flow back to your heart. So I pulled up this picture from 3 days ago. As you can see, his ankles are gigantic, much larger than a healthy person. This disease can have a significant impact on the quality of one's life. Donald Trump is too old to be president.
Obviously, we know you're not treating the president, but if he's working around the clock, tell us a little bit more about this condition. How common is it?
Well, this diagnosis can certainly make working around the clock more difficult, Kana, as this diagnosis often comes with persistent swelling, sometimes pain, and sometimes difficulty with mobility. So chronic venous insufficiency, it's a diagnosis that involves a problem with veins that require blood flow back to the heart. In this diagnosis, that blood flow isn't appropriate, or that blood flow isn't enough, and that can cause pooling and swelling, and that can lead to breakdown of the skin, increasing the risk of ulceration, and that can also increase the risk of a bacterial infection that can require hospitalization. Kana, I often see complications of this diagnosis as it is extremely common. It's estimated that up to 3 out of 10 people over the age of 50, adults in general, have this diagnosis, and many times it brings them into the emergency room for various reasons.
And then how do they go about treating this?
Yeah. Well, the treatment can be variable from person to person depending on how severe this diagnosis is. For most, it often involves basic mechanisms and interventions such as compression, which can increase the pressure on the affected limb. For example, if you have swelling in the limbs, that helps with blood flow return. In some cases, there are medications to optimize blood flow from the heart. And in certain cases, in severe cases, there can be certain types of interventions and procedures that are done by a vascular surgeon that can help to make sure that that blood flow is returning. But at the main point of it, Kana, is understanding how to prevent. Many times this diagnosis, again, comes with types of infections, and that's what we're really counseling and educating patients about.